Welcome to open enrollment for QED Enterprises. My name is Nicole Cavender with Arrow Benefits Consulting, and I'm here to assist and help you understand your benefit partners and the roles they play, as well as the plans that they provide for you to choose from. This year, we will continue to provide medical coverage through United Healthcare, as well as dental and vision. However, we have decided to change our coverage for our life and disability coverage and bring in the Hartford Life Insurance. We will continue to offer colonial benefits, and you will continue to use your payroll network iSolved enrollment partner to make your selections for these benefits. And iSolved Benefit Services will also provide you the ability to select to enroll in a flexible spending account. Open enrollment is the one time of year that you can make changes to your benefit choices. You do need to satisfy a waiting period if you are a new hire, and you must wait until the first of the month following your date of hire to enroll. If you work 30 plus hours per week, you are a full-time employee, you, your spouse and/or domestic partner, and dependent children are eligible to enroll. If you're a part-time employee, we do not provide coverage. Your deductibles will reset on October 1st, and it's important to review the updates that have occurred to your actual plan details. Review all of the elections that you have made or choices that you will make. It's important to review all of your choices as it relates to each line of coverage, as well as review and update beneficiaries. Outside of this initial enrollment period or open enrollment, you must experience and prove a qualifying event has occurred to make a change to your coverage elections. A qualifying event would be something such as a loss of or gain of coverage elsewhere, marriage or divorce, or maybe the birth or adoption of a child. QED does contribute to your cost for your medical coverage and does provide a base term life policy in the amount of $50,000 with accidental death and dismemberment coverage as well. You do have a whole host of benefits to make elections from. I know that many of you will be anxious to review your costs. These are the new costs for your medical, dental, and vision coverages. All of the other lines of coverage and choices that you have to make are going to determine your cost. For your FSA medical contributions, we have illustrated what a maximum contribution would look like on a biweekly and weekly basis. These are not set amounts. You can elect up to that $2,850 maximum annually to be deducted on a biweekly or weekly basis. The same is true for dependent care. Now, your dependent care maximums are different. If you're a single person putting money away out of your paycheck, you can contribute up to $2,500 annually. If you are a non-single or married couple, you may put away a maximum of $5,000 annually. As I told you, there were some updates and changes to the way the plans work and some of the services within them, so it's important if you have some of the services shown here, you might want to review the plan in more detail. We do have a new contract under the state of Virginia, and so there are some things that I do want to point out that are slightly different that we are going to see within this plan this year. Most important and impactful is the pharmacy tier update, as well as the designated diagnostic lab x-ray and imaging, as well as the out-of-network benefit change. We'll talk more about this when we get into the plan details. Additionally, we made some carrier changes, as we stated earlier, so we have also made some changes to the way the benefits work together. This afforded us some savings on the rates for you to consider, and it also will include Virginia disability mandates. Now, most importantly, when we start talking about employee benefits and the medical coverage, it's important to know that where you go and who you see matters. Not only getting to know that your care options and the cost of those care options as you go from a primary care visit to an emergency room, not only knowing that those costs to deliver care in those settings is different, but also knowing that the very first part of your benefit plan that you may not notice is the fact that United Healthcare has negotiated rates on your behalf with physicians who have agreed to those contracted rates. Those physicians that have agreed to that contracted rate for those services that you need are in network. If you choose to see a physician that does not participate with United Healthcare's contract that they've negotiated, they are not required to accept the payment from United Healthcare. This could mean additional costs to you that you might not expect. So it's important to first note that the Choice Plus employer plan is the network that you need to search in order to find those physicians that are going to provide services at the best cost. United Healthcare works to negotiate with the providers that you seek care from, but they also work to provide cost savings and find those pharmaceutical companies and delivery systems that will provide you the best cost when you get your pharmaceuticals. United Healthcare uses a network for this as well. The network that's going to provide the members at QED the best cost is the Standard Select Network. The Standard Select Network is comprised of over 50,000 retail pharmacies. Walgreens is being highlighted as their flagship store, but that's not the only pharmacy you have access to. We will provide a list in your benefit document download that will give you access to those lists of other pharmacies that you may want to use. But it's very important to note that this is going to affect your cost, so make sure you're visiting that Walgreens store or at least visiting the list to make sure that your pharmacy is on it. On the designated diagnostic providers for lab and imaging, these providers have been identified not only to provide the most cost-effective care, but also the best quality care. So picking these providers to perform your lab and imaging is in your best interest. Again, when you're locating providers, whether it be a provider for services, medical care itself, like your primary care physician, or even a pharmacy, you can rely on myuhc.com to help you find everything you need right at their homepage. Once you've gotten to the MyUHC homepage, you can pick from the people, the places, services, and treatments, but you can also get cost estimates and research the care for some more common conditions. What I want to note to you is when you're looking for your services and are not yet a member, you want to make sure that the plan that you see in the top left corner of your screen is Choice Plus. Under your Choice Plus plan, you do have a $750 deductible as an individual. You also have copays that are required for certain services. Both the deductible and any copay that you are required to pay will accumulate, and once that dollar figure has accumulated to $8,550, your plan will pay 100% of your costs. Now, how else will we get to $8,550 if we're paying copays of $30 and $60 as shown for your primary specialist and lab visit? Well, as you'll see, if we do not use the designated network, the first place that we might see that additional cost that might get us to that $8,550 maximum out of pocket is when we use an imaging facility to do x-rays that is not a designated network. At that point, we'll be required not only to have met our deductible, but to then pay 20% of the cost. This is where you can clearly see if we use the designated network, we can save significant money. In addition, let's look at that out-of-network expense. If we choose to go out of network and see a physician that has no contract for those x-rays, we are not only going to see the deductible in the out-of-network column, which is $2,000 and completely separate from the in-network deductible, but then we will also be on the hook for 40% of our costs. And those costs have not been negotiated by United Healthcare on your behalf. The out-of-network benefit is here for a safety net. It is not meant for you to utilize to seek care in all settings. Now, specialty imaging, even if you remain in the designated network, you will be required to meet your $750 deductible and also be required to pay 20% of your cost for that specialty imaging. But note, the 20% of the cost, that cost has been negotiated to be the lowest cost that United Healthcare can negotiate on your behalf. If you choose to see a less effective, less quality physician for your care, United Healthcare is going to require an additional deductible specific to specialty imaging. That will be in addition to the plan's overall deductible. You may be subjected to co-insurance, none of which can exceed 50% of the amount of that service. As we get into the urgent care, that's back to co-pays, which is nice to see. And of course, we want to avoid the emergency room or inpatient hospital stays. But if we do end up in the emergency room or inpatient, we will have a $750 deductible and then a $350 copay and or a deductible and the 20% of our cost of our care for the inpatient stay. This is where you can see the value of an out-of-pocket maximum. Assuming that we've met our deductible and we show up at the emergency room, we only have a $350 copay. But let's say the result of that visit was an inpatient hospitalization. Well, our deductible has been met, as I said, so we're only on the hook for 20%. Let's say the hospital bill is $100,000. If you were responsible for 20% of it, well, that would be a huge expense, $20,000. This is where that medical out-of-pocket maximum comes in and protects you from that type of expense. Now, I want to drive home some of these details about that standard select network with Walgreens being their flagship store. We've talked about this before, but now you can see how that network being ignored could affect you when you go to receive your prescriptions. United Healthcare breaks prescriptions up into two types of prescriptions. You are either in a standard prescription drug product tier or you are in a preferred specialty prescription product level. And within those tiers or those product levels, they have tiers of affordability within those product definitions as well. There is a list available so that you can search your particular prescription to find out which tier you fall in, and you can make note right now that we want to stay in that first column, that retail network. That retail network is the standard select network that we talked about. And you can note that if you look over all the way to the right, we can actually, using that standard select network, obtain our prescription, a 30-day supply for $10 at the tier 1 level. And if we wanted to get a 90-day supply of that prescription, we could receive that for $20 by doing it through the mail order network. So taking a look once you get your cards and getting familiar with this plan information and how to set these things up is what we're here to help do. So if you would like that engagement, you can certainly sit down and talk with me following the meeting or schedule your appointment. Now, when we get into that product, the preferred specialty prescription tier, you'll note there is no mail order available on that. And you'll note that we definitely want to stay in that preferred specialty network, because if we're looking at a non-preferred specialty network pharmacy, our cost sharing is extremely high. The reason we're seeing this is because pharmacy is making up the majority of our spending these days, and these prescriptions are expensive that they are creating to help with our wellness. We're going to move into our dental coverage. Dental coverage is very different than medical in that when you purchase dental coverage, the annual maximum benefit refers to the amount that comes out of the insurance company's pocket. So very different than our out-of-pocket maximum in medical, what's coming out of your pocket. Dental annual maximums are meant to cover the insurance company. So you'll see here that each person that you enroll is going to get $1,500 to spend on services. Now, how is that money spent? Well, you're going to have 100% of your preventive services covered, and you will have 100% of your basic services covered. 80% of your major dental services will be covered, and 50% of your orthodontic coverage services would be covered. Let's assume you're having some major dental services done. In this case, it's a crown, and the crown costs $1,000. In that case, the insurance company is going to pay 80% of that $1,000 in network. This is what the in-network provider is charging. They're going to pay 80% of that. 80% of $1,000 is $800, so you still have some money left to spend. Again, network. They have contracts with providers that will provide you the best cost for these services. So please, if you have a dentist that you like and love, call me. Let's look them up. If they don't participate, let's try to find out if we can get United Healthcare's contracting team to reach out to them. The other great thing about your dental plan is that when you use this dental plan, if you get your cleaning at least once a year and your annual claims come in under $750, they will allow you to roll over a certain amount of money. Now, the best part is that $400 rollover that they give you to put into next year's maximum. If you've used the in-network dental providers, they'll give you another $100 as well. So, and each year you can do this. So year 3, you've earned up to $1,500, and that would take you to your total amount that you're allowed to accumulate up to $3,000. So that could be very helpful for those of you that are planning some dental work. Your myuhcvision.com is the best place to find your vision providers. But once you've found your vision provider, you will be able to, every 12 months, have one comprehensive exam, change out your eyeglass lenses, get new frames, and even contact lenses. And for those diabetics that are on the plan, you'll be able to have an eye exam twice every 12 months. Now, there are co-pays for services. So for your exam, there is a $10 copay. If you have eyeglasses, lenses, and frames, you'll have a $25 copay. If you choose contact lenses instead of eyeglasses, you'll have a $25 copay as well. And then there are frame allowances and contact lens allowances as well that you can see here. QED recognizes the importance of planning for that unexpected loss of life or accidental death and dismemberment, and to that effect, put in $50,000 of coverage for each and every employee at no cost to you. $50,000 may not be exactly what you need to cover your risks and may not be enough to leave behind for your family. You are able to purchase additional coverage. For employees, you'll be purchasing in the amounts of $10,000 increments, and you may purchase up to 3 times your annual earnings or $300,000, whichever is less. And for your spouse, you'll be able to secure $25,000 in coverage or 50% of your elected amount, whatever is lesser. Children are permitted to have $10,000 in benefit. Your supplemental life insurance rates are going to be printed on a paper form in the event you'd like to have them available. Those rates will be available in your document download. I would like to call attention to the fact that we have 2 pay periods at QED. So if you are a biweekly pay period or a weekly pay period, you want to verify that you're looking at the right rate chart by looking directly under the name of the benefit, and you'll see that 26 pays per year is highlighted here with that yellow arrow. And if you're a weekly pay period person, then you need to make sure yours is 52. No fretting about calculating any of this. The rates in the system will be figured automatically by the amount of coverage you select, so it will be very easy. But for those of you that want to pull this out and look at it on paper, it'll be available. On the voluntary short-term disability, this is to protect your earnings. And as I said, we made some changes to this. So we are still affording 60% of your earnings to a maximum of $1,500 per week. And it will start on the 15th day, whether it is a sickness or an injury. What we changed was how long this policy would last. Before, we had 24 weeks of short-term disability. So we have issued an 11-week disability policy, which has brought your rates down and backed it up with A long-term disability policy, still the same, affording you 60% of your earnings to a maximum of $10,000 monthly. This plan is purchased and figured off of $100 increments. And your benefit on this will start after 90 days of disability, which if you calculate the 2 weeks on your short term plus the duration of 11 weeks of benefit will bring you up to this 90 days. So it will seamlessly bring you into long-term disability. And we were able to get this at a lesser rate as well. As part of the life, long-term, and short-term disability options that are available, you'll also have a whole host of assistance programs, things to assist with mental health, beneficiary assistance, counseling service, estate and will guidance, funeral concierge services, as well as travel assistance and ID theft. Colonial Life is where we start talking about those tools that we can use to offset some of those expenses that we discussed under our medical plan, and in those cases where we may end up out of network. Colonial Life allows for you to collect a benefit that pays cash to you in the event that you are confined to a hospital, so inpatient admission. Hospital confinement insurance may have additional benefits for certain things like diagnostic procedures or emergency room visits, and you can see how quickly that can stack up. So in this particular example that they've illustrated, Nathan had $1,625 in expenses and ultimately ended up with $1,875 in payout from his Colonial Life hospital confinement plan, and was able to pay those expenses he was subjected to from his medical plan with that money. Now, that doesn't mean that's what you have to do with the money. We're just showing you an example of how it could be helpful. The accident plan works very similarly, so their accident plan is going to pay out per occurrence. If something happens to you and you have broken a bone, you're going to be paid based on that occurrence happening, and each type of accident has a dollar figure associated with it. This could be helpful for you in those times when you have that unfortunate accident. Critical illness insurance is meant to help with paying for lost income, maybe travel and lodging for a special treatment center access or to stay during an extended period of time. Could be for medical expenses or rehabilitation. These are policies that can be extremely, extremely lucrative and helpful. So look at the jaw-dropping amounts that you can access for critical illness on these Colonial Life critical illness policies. As we discussed, iSolved has a couple of different platforms. We're using 2 of their platforms here. One, to manage and assist with our flexible spending account administration. Ultimately, the money that you elect to put away will be set aside and deposited into a flexible spending account on your behalf. The amount you set aside per pay will actually be set aside in an annual amount for you to spend immediately. This helps you in a number of ways. The first way is you're going to pay fewer dollars in taxes. It's going to reduce your taxable earnings. That money will be deposited, still able to be spent, so you do get to keep the income, but you're not going to pay tax on that money that is set aside to go into the flexible spending account. Because you have set aside that money on a pre-tax basis and you're not permitted to make changes to it, you have access to the full amount for your annual election on day 1. As long as you spend the money on deductibles, co-pays, prescriptions, dental, orthodontia, vision expenses, then all of that money that you have put aside will be spent tax-free. So ultimately, this increases your spendable income. You will be issued a debit card to use to pay the expenses, such as those that we discussed on the previous slide. If you're using the card and we do not have it auto substantiate, you may be required to answer a letter. If you don't answer the first letter, they're going to send you a second and a third. If you find your card deactivated, you may want to follow up with them. It could be that your card has been deactivated because of a substantiation request. But if you lose your debit card, don't worry. There's always someone to call. And again, this is administered by the iSolve Benefit Service team, so we can certainly assist with getting you in touch with the right person if you need assistance with this. The other iSolve service that we use is associated with Payroll Network, where your payroll information is kept and where you will be making your benefit elections. You will be using the Employee Self-Service tab, and that will be the first tab you'll want to click, which will then allow you to access the Important Employee Messages field and find those benefit summaries related to each of the benefits and any flyers and resources that we've put together for you. You'll then want to connect or click on the Benefit Enrollment Wizard and walk through step 1 through 4 to complete your enrollment. Quick tip, there is a pink colored box that says submit to confirm your enrollment is complete. Please make sure you've made it all the way to that step. Your enrollment will not be processed if you have not clicked submit and confirmed your enrollment. Your next steps involve 3 easy steps. We need you to review the enrollment resources at the Payroll Network myisolve.com account and schedule your private enrollment meeting with myself and Nick Cusmano in order to make sure that we've got all of your questions answered and you feel confident making the best decision for yourself and your families. As always, there are a lot of partners involved, but we're all here to assist you in making those decisions. And throughout the year, if you have any troubles or would need to make a claim, you can use this contact information to reach any of these partners involved. On behalf of Arrow Benefits Consulting and all of our benefit partners, I want to thank you for attending the QED Open Enrollment, and we look forward to meeting with you soon.